what we're going to do today really is kind of just take a quick look at HIPAA and then what it means to have a HIPAA-ready solution. And the solution we're specifically going to be discussing is commerce. And our partners at Perficient have built a kind of a platform, right, or a solution that is HIPAA ready, utilizing Adobe's commerce product in order to deliver kind of the security and the privacy that our healthcare customers expect. And so, Justin, thanks very much for joining me today. If you want to spend just a couple minutes introducing yourself, that would be great.
Sure. Yeah, thanks, Tom. Appreciate you having me here and appreciate collaborating with Adobe, as well as CMS Wire, someone who I contribute to and love the publication. So as Tom said, my name is Justin Racine. I'm principal over our commerce strategy group here at Perficient. Perficient is a global digital consultancy that works with Fortune 500 brands to help them really build exceptional, beautiful experiences for their customers. I've been in this role at Perficient for 4 years. And before that, I actually spent time on the client side in the medical device and healthcare space, working for manufacturers and distributors, selling health, wellness, and medical devices to various different healthcare settings. So this whole topic of HIPAA and healthcare, it's close to my heart. I kind of grew up in this space. And it's always good to jump on a call with Tom, too, and talk with him. So it's great that folks are on here. We think we have some really interesting perspectives to share, and are looking forward to hopefully having some open Q&A and answering some questions as well. So thank you, Tom, and I'll kick it back to you.
Awesome. Thank you, Justin. As Justin just teed it up for us, right? We're going to spend a little time kind of going over kind of HIPAA 101, right? What does it mean in kind of digital technology and the marketing technology space? And then I'm going to hand it back to Justin, and we're going to do a quick product overview and kind of talk about how commerce can play a role in improving the overall kind of patient or customer experience within healthcare. And then, right at the end, hopefully we'll have some open Q&A, right? I mean, I already see we have a question in the Q&A pod, so I would encourage anyone and everyone, right, to, if you have questions, put them in there. Justin and I are going to be monitoring it, as is Jared. And, if we can answer a question in process as we're going through the very brief prepared material we have today, awesome, we will. If not, we'll just wait until the end and do the Q&A as more of kind of like a discussion period. So let's jump right in. And as I said, we're going to start with kind of Adobe's perspective on HIPAA and kind of the basics around kind of what is HIPAA, why is it important, and why should all of us, right, that are on this webinar today care about it, and how should we pay attention to it? Now, I'm sure many of you are very familiar with HIPAA, but Justin, and this is something that I've seen repeatedly, is even working with our customers. They understand that HIPAA is something that they need to pay attention to, but they're not really quite sure why, right? Or what it is that's kind of in play or at risk, where HIPAA is concerned. Bottom line is this, right? HIPAA was actually introduced in the late 90s, right? Way before all of the kind of digital technology and this idea of, personalizing digital experiences was ever even an idea. And really the foundation of HIPAA was to protect health information, right? Protect PHI, protected health information, and it's information that can be essentially tie a clinical condition or a clinical state to a specific individual. And this law essentially was to prevent health insurance companies from using this information to make determinations as to whether they were going to cover a pre-existing condition or cover a particular individual. So this rule was put into place. And since then, it has actually kind of been used as the foundation for any and all protective measures around healthcare data. Those, right, that actually have to pay attention to how they ingest, how they store, how they use this protected health information are defined here, right? They are health plans, healthcare providers, healthcare clearinghouses, and these are the folks who kind of collect and distribute healthcare information, and then also business associates of these covered entities. So the term covered entity means any organization, right, or entity that is actually covered by HIPAA law. So you see those here, right? Insurance companies, doctors, hospitals, dentists, these clearinghouses and other government entities. And then companies like Adobe or Proficient who do business with these covered entities are what are considered business associates, right, of these covered entities. So while Adobe in and of itself is not a covered entity and really is not concerned about HIPAA law or HIPAA rules, when we work with our healthcare customers, we become a business associate. And at that point, we have to sign what's called a business associate agreement, right? You cannot accept or work with PHI if you don't have a written business associate agreement in place. And what that business associate agreement basically says is that we, right, as Adobe or any other partner or vendor or associate with a HIPAA covered entity will adhere to the same rules and the same legal requirements that those covered entities have to adhere to. Justin, you got anything you want to add to that? Or is that a pretty good explanation of what HIPAA is and why we care?
I think it's a great explanation. I think the only thing I would add is that HIPAA and PHI is something that is so vitally important because the ramifications of having an experience, digital experience specifically, that is not in line with these various I won't call them programs, but safeguards, if you will, could be extensive. So I think it's very relevant to kind of go through this and know that it's super important because there's so many things that have to be covered under it. And if there's a breach, I mean, Tom, you probably know better than anyone, that could be a big problem for a brand.
Oh, it can be a big problem, not only for the healthcare company, but anyone that's working with that healthcare company. And, if it's situations like where, this company is utilizing the Adobe tool set to kind of collect and store and then analyze and use this protected health information, right? It's during that kind of collection and transmission process is where most breaches, take place. And so it's making sure, right, that anyone as a healthcare covered entity, anyone you're doing business with is kind of actually following the same rules and playing the same game in terms of data protection that you have to, right? So that's actually a very important kind of decision-making. A part of decision-making as to who you're going to partner with is, do they have, HIPAA compliance as part of their architecture, and are they willing to sign a BAA? And Justin, this, right? There's a lot of companies out there that do work with healthcare organizations that are unwilling to sign a BAA because, quite simply, they are not able to meet the standards that HIPAA requires.
That's right.
So one of the things, if you've done work with Adobe, and even if you haven't, right, if you're working with other business associates, I think it's important that we understand the difference between HIPAA readiness and HIPAA compliance, right? And the fundamental difference is that software or software systems cannot be HIPAA compliant, right? They cannot be certified as HIPAA compliant. Only a person can be certified, right, as being kind of aware of what the HIPAA rules are. Now, software and human processes, right, can be designed to help people be HIPAA compliant. But if you ever run up against a software system, right, that says, oh yeah, we're HIPAA certified, we are HIPAA compliant, it's simply they're kind of misusing the terms, right? Because even if a software system or a process is put in place that meets all of the HIPAA requirements regarding privacy and security, ultimately, use of that tool is the only thing that can determine whether that tool is being used in a compliant way or not. And the use of that tool is done by people, right? So if people are certified, right, as being HIPAA compliant, and they understand the rules of what data can be used and how it can be used and how it should be stored, right, even if they, right, are using a HIPAA-ready software tool, if they use it in a non-compliant way, that renders the entire system as being non-compliant. So Adobe is very intentional when we use the term HIPAA-ready, right, because we have done everything within our power, right, to make the data platform secure and private according to HIPAA rules. And then we've also put into place the kind of the governance tools and access tools, right, to make sure that only the appropriate or the right people have access to the data, and that they can only use it in appropriate or compliant ways, right? All of those guardrails are in place. But going back to the kind of the crux of the issue is, even with all of those guardrails, if someone who is not authorized, or if someone who, even if they are authorized, uses the data in an inappropriate or non-compliant way, regardless of the HIPAA readiness of the platform, like I said, it renders the entire system non-compliant. So when you're talking about HIPAA and how it specifically applies to the Adobe toolset, right? And when I'm talking about the Adobe toolset, I'm talking about the Experience Cloud for healthcare, right? And how we kind of collect, store, manage, and use protected health information, and then how the Adobe tools, right, can use that information to kind of generate insights into your customers, and then make recommendations around what content they should see, when they should see it, and in what channel, right? So that goes back to this whole notion of personalizing digital healthcare experiences and utilizing the tools, right, that enable healthcare companies to do all of the cool personalization things that retail companies do, and travel and hospitality and banks, right? Where as healthcare consumers, we have built expectations around what a digital experience should look and feel like. And healthcare now is no different, right? We understand as consumers that these healthcare companies have data on us, what our behaviors are, what our preferences are. They have all of this clinical information that we've defined as PHI. And as consumers, we expect them to use all of that information now to better serve us as consumers. And by better serving us, I mean giving me what I'm looking for, when I'm looking for it, where I'm looking for it. And commerce now is another kind of extension of that personalization, of enabling me, right, as an informed consumer, to be able to execute on a transaction, right? And to be able to, not only see what I'm looking for and make that informed decision, but now finally be able to actually execute on the transaction and to be able to do it in a HIPAA compliant way. And that's where I'm going to hand this off to Justin now to kind of walk us through kind of what that new personalized healthcare buying experience can be.
Yeah, thank you, Tom. And that was a great overview. And I think it's always great to level set on HIPAA and PHI, the differences between HIPAA compliant versus HIPAA ready. It's important to note, right? And I'm guessing a lot of the folks that are on this webinar, you're probably in the healthcare space. So hopefully that was just a refresher, right? And not new information. But what I kind of want to talk about is the opportunity that brands have within the healthcare arena, specifically around what Tom was alluding to, which is this sort of new consumer experience and new desires, and talking a little bit about how healthcare and medical devices has moved from a reactive mindset from the consumer into a proactive mindset. So first up, I just pulled up a statistic here from an EY survey that basically talked about how 73% of the survey respondents would agree to have their medical information automatically shared electronically with different places they received medical care. I mean, that makes sense, right? If I'm going to go get care somewhere, I kind of want them to know my medical information. But they did make it clear that they want to know upfront how that personal information is being protected and used. 80%, right? Almost everyone agreed or strongly agrees. That's really important. And the reason it's important is because that means that consumers or patients, they want and they're comfortable with their information, their most personal healthcare information being shared to receive better care. But they want to ensure that it's being protected and it's not going out elsewhere. And I think that's why this solution that Adobe has is very timely based upon some of the things that have happened over the last few years, specifically after COVID, and I'll kind of talk about some of those too. So one thing that I also pulled up here, and this is again from this EY survey, is patients' desire for ease of use and access to care. So obviously this chart here is from various different countries, but if you look across the top, outside of Germany, right, or even go over to the United States on the right, the drivers of performance are ease of using healthcare services, access to care, and improving health of the community. But those first two are super important, right? I want to have access to the care that I need, but I want ease of use when I'm using healthcare services. And a healthcare service could be a platform. It could be a digital commerce experience. It could be just a website. It could be a referral outreach through email. Whatever it is, this is what patients are desiring. They want to be able to access the care they need. They want to be able to have ease of use when navigating their healthcare. And that all aligns to this market holistically as far as the direction that consumers are moving into. And why are they moving it into that direction? It's really a lot of what happened during COVID. COVID kind of really changed the game for every business and brand, but primarily for folks within the healthcare vertical or consumerization in general. There was a consumer shift after COVID, right? It pivoted consumers to purchase digitally for the first time. If I needed to get my prescriptions from my local pharmacy, I couldn't on lockdown, right? The pharmacy had to figure out ways to deliver to my home or other options of getting me the prescriptions I needed. A lot of folks look to move into using technology to achieve that. But what did happen is consumers experience new options, such as buying online, picking up curbside, the demand increase for having inventory transparency. But most importantly, what happened during COVID is consumers finally put their health in the driver's seat and started to purchase new product categories that would keep themselves and their family healthy. Previously, hand sanitizer may not have been something that folks bought at their home. But after COVID, they created new habits. The real big driving home point here, and Tom, I'm curious, I'm going to pause here because I'm curious what your feedback is that traditionally, at least for the years that I've been alive, healthcare in general has been reactive. I went out, I played soccer, I hurt my ankle, I will go to the doctor so that he can make it feel better. But we're in a world now where we have wearable devices, we have telehealth, we have the ability to have trackers on us that go directly to our doctor's office. And the consumerization of healthcare, more importantly, proactive healthy lifestyles and proactive health as a consumer category seems to have flipped the script where we've moved from a reactive mindset of, ouch, my ankle hurts, to I don't want my ankle to hurt down the road. So how can I engage with brands and products and experiences through technology in some instances that help me be proactive? Tom, what are your thoughts on this? I mean, I'm guessing, I know we're the same age, but I'm pretty sure that you have a little bit more experience than I do in this arena. Are you seeing that too?
Well, I'm confident we're not the same age, Justin, and I've seen significantly more. I mean, I actually remember house calls, right? But your point, I think, is an excellent one, right? Because I do believe that kind of during and then post-pandemic, we hit that inflection point, right, that you're talking about. Pre-pandemic, I think we all accepted as healthcare consumers that the healthcare ecosystem was doctor-centric, right, or provider-centric, where, like you said, Justin, it was reactive or it was episodic, right, where you only engaged your healthcare ecosystem when you needed to. Then hopefully, right, you were treated and you got better, and then that was it, right? You dropped out of the ecosystem. And engagement of that ecosystem was very much done at the time and the place that was convenient for the provider, right? As opposed to it being convenient for the patient or the customer. With the pandemic, right, we saw the healthcare industry forced into digital channels where they had previously not been actively engaged. And that forcing into those channels, I think, shined a very bright light on the fact that the healthcare industry was not, right, ready for that shift, or they weren't utilizing the technology that other industries were already using, right? Because, and I mentioned retail, or say, buying plane tickets or doing personal banking, and how you can do all of that, right, online. And they're utilizing your purchasing history and your preferences and all of that data in order to present to you offers and content and stuff that is relevant specifically to you and where you are in your specific buying journey, right? And I think as consumers, we were all not surprised, but kind of horribly disappointed, right, that healthcare was not even close to that. And I think that that's what's changed, right, is that I mentioned house calls, telehealth, right, or virtual care that became, the primary means of engagement of your healthcare ecosystem during the pandemic, right? If you just needed kind of routine care, right, you couldn't actually go to the physical facility and see the doctor. And all of that, I think, introduced an expectation around convenience and an expectation around access. And, it's with the advent of, and sorry, dude, I'm starting to soapbox here, with the advent of like retail access to healthcare at CVS clinics and at Walgreens, right? Now you could actually go get care without an appointment, right, in a place where you're going to be going anyway, right? So I think the shift towards a consumer-centric model away from a provider-centric model, and the fact that healthcare consumers are basically standing up and saying the way things were is unacceptable, and I expect you to be in these digital channels where I already am, and I expect you to use the data to personalize those experiences for me. And if I don't get it, I'm going to go elsewhere, right? And so if I don't get the convenience, if I don't get the access, if I don't get the value of scheduling an appointment with my doctor for 2 or 3 or days away or a week away or whatever it might be, I'm just going to go someplace else. Even if it means spending money out of pocket, I'm still going to go someplace else because the value of convenience and access and timeliness and such is worth more to me.
For sure. And then especially when it comes to healthcare too, I think anyone who has had, health challenges in the past or has gone to the doctor, I mean, healthcare is not like buying a pair of shoes. Sure, you might need those shoes to go running, but it isn't life or death, right? But healthcare can be, and it's something
Correct.
that is so important to all of us. So based upon all of that, what is the opportunity? Well, the opportunity here, and this is a statistic I use all the time, but 86% of consumers will pay more for a better customer experience, something that is curated and tailored to what they're looking for or their health. If I have a certain medical condition now that I'm managing, that doesn't mean that I won't have a different one down the road. God forbid I do, but it could happen. So how can experiences be tailored to that individual, but also secure their data so that as their health progresses or declines in certain areas, new products or services or content can be queued up, right? So there's a big opportunity here that Tom and I have been kind of collaborating on, where there's the consumers that are out there are choosing healthcare as a proactive consumer category, which is not something that was traditional previously. So with that, the folks, if you're on this webinar and you're listening in, it represents a really great opportunity for you to tap into where consumers' heads are already at and going with the services that you offer. And in doing so, you're going to be able to obviously drive more revenue for your business, but at the end of the day, create a better experience for your customers, your patients, that ultimately will have them coming back. With that, these are some of the top healthcare commerce predictions that we're sort of kind of seeing for 2024 within this space. So one is the increased role of the non-traditional healthcare professional. It's almost like, Tom, you read my mind, right? But I think maybe, Tom, I'll pause here for a second, and maybe you can speak a little bit more to this, but the non-traditional healthcare professional, maybe traditionally or decades ago, was, well, I'm not going to go to anyone but my doctor because my doctor is the authoritative person. But now it seems like consumers are open to the idea of, maybe I go see a NP, a nurse practitioner, or maybe I go see someone else who can still provide me value because they're giving me what I desire right at the moment or at the inflection point.
You're spot on, Justin. And I think a significant part of that is the availability of information, right? Which, I mean, we did some studies not that long ago that said that regardless of age group, right, age demographic, but something like 90% of healthcare consumers check with Dr. Google before they actually talk to their doctor, right? So they're going online and researching, what a particular condition they might have, or what, symptoms of something might be. And they're making decisions then kind of based on the information that they have available to them, right? And that information, that having availability to what is in most cases, right, clinically accurate, depending on where you go, having availability or being able to access that before going to your doctor has really changed the dynamic between the patient and the doctor, because now patients are going in more informed, right? And they also understand, right, that now I can research who is the best solution or where am I going to get the best treatment, as opposed to just going to the same doctor that you've gone to forever, right? And so I think access to information and then access to kind of other options and other channels is what's driving a significant part of the change that you're talking about.
Yeah, I love that point, Tom. The access piece is so huge, right? Because again, like we talked about, if you have health issues or challenges, or that you want something now, then you want it now, and the access is a big piece of that. The other bullets.
Well, and I think, in all honesty, Justin, I think the digital channels, the internet, all what social media has all really changed that expectation regarding immediacy, right? Where it's like, I want it now, and if you can't give it to me now, I'm going to go find it someplace else. I mean, that's a buying habit kind of, and a consumer behavioral habit that we've seen just explode like in the last 10 to 15 years, where previously, if you actually had to get in the car and drive someplace to go look at the shoes that, according to, one of the members in our audience, could be a life and death situation.
They could be. That's a great point.
Right. But it was a whole different dynamic, right? Of you got to pack up the kids, you got to get in the car, you got to drive to the mall, then you're going to go shopping, as opposed to being able to look for anything online, buy it online, and have it delivered to your house later that afternoon. Right. And I think those consumer experiences are finally having an impact in the healthcare industry, and those consumer expectations, right, are driving change in the industry like we've never seen before.
Yeah, agreed. And I only think, I love all the points you made, Tom. I think it's only going to continue, right, as we go forward. And, some of the predictions here we already talked about. I think the other one that's important too, outside of the personalized health consumer experiences based upon condition or the proactive mindset, we kind of hit on some of those, but the last one on the right-hand side is the manufacturers that are looking to leverage the direct-to-consumer channels, right? You have these branded Fortune 500 manufacturers who are medical device or in the medical device category, and they're now looking to expand into direct-to-consumer activities where maybe some of their products they're opening up outside their traditional distribution channels and are looking to sell directly to the consumer. And Tom, I'm going to ask your opinion here too. And I believe the reason is because, as Tom pointed out, we as consumers want access. There's no better access than to work directly with the brand. And moving into this space is likely something that consumers are looking for. They want to have conversations and direct access to the source. Right, Tom?
Yeah, no, and Justin, I think it extends beyond, devices. I mean, we're seeing that extensively in the pharmaceutical space as well, because there's this expectation now, not only on the part of the consumer, but also on the part of the provider, that the pharmaceutical company will kind of play a role in education, play a role in helping with adherence, right, to a treatment plan or to making sure that you're taking your prescriptions, and also to regarding cost, right? So, I mean, we are inundated with pharmaceutical advertising on a daily basis, right? And how often now, they used to always say, check with your doctor, right? Yeah. Or ask your doctor. And they no longer do that, right? Because they're trying to actually establish that direct consumer bridge. And they're saying, if you need help paying for this, contact us, right? Yeah. Or if you have questions, right, contact us, which I think, again, is a very different dynamic. And like you said, we're seeing that with medical devices as well, where they would rather go directly to the provider of the tool or the device or the drug, rather than using their doctor as the intermediary.
Absolutely. It's a traditional marketing tactic of push-pull, right? And the pharmaceuticals are leveraging the pull, right? They're going directly to the consumer, pulling them up where the consumer or the patient's requesting from their doctor the script needed. So Great points. Okay, so with that said, we kind of want to close out here with just some other key industry trends. We have one or two more slides outside of this, but we really wanted to have an open conversation and discussion here too. So if you do have questions that you want us to answer or talk about, definitely feel free to enter those into the questions area here, and we'll kind of hit them as we go through. But these are just some interesting trends that we kind of pulled together, based upon things that are going on in the space. The first is that virtual health is really here to stay. 46% of healthcare consumers, they're already using telehealth, right? And that only is going to extend forward as consumers look to take, more proactive steps in their own healthcare. And also the clinical population struggle to keep up with the pace of innovation, right? I mean, the innovation is all around us, but as Tom talked about, like social media and all these other channels where people are getting information, they're, YouTubing their symptoms or Googling their symptoms, something we all do. And that's the next point here too, is that, consumers, they're researching different options, and, the things that happened during COVID, can at times make it difficult for certain demos to happen in certain situations. I mean, some of those protocols are still in place where that virtualness or technology is needed. So we won't go through all of these here. I mean, I think the important one, the last one to call it, is just the wearables. The market is really set to reach 60 billion by 2027. I mean, that is 3 years away. And as it continues to move forward, there's going to be new opportunities to serve different types of consumers that maybe your brand didn't have an opportunity to serve previously. So with all of this being said, I think the point here that we kind of want to drive home is that Adobe has built a really great solution around the HIPAA PHI realm that allows organizations to get down the path of compliance, right? Because as Tom told us, we can't say compliant, but we can offer solutions, or we can build technology that is HIPAA ready and that is PHI ready, so that as you start to serve these new consumers, or the consumers that are moving into the proactive world, you're doing so in a way that's conducive to what they want, which is, I want access to the care that I have. I'm okay giving you information about myself as long as you're protecting it. And I'm okay with you doing that if it helps me have a better overall experience and recommend products that are relevant to my condition. Tom, anything you want to add in on this slide before we kind of...
I think that's exactly accurate. It was a great summary, right? And I think, Justin, what that does is it leads us into a couple of the questions, right? And so if I can use this kind of as a jumping off point for a couple questions that we've gotten from the audience before we move into whatever the next phase of this webinar is. We got a question. It's a very general question about how do you protect a client's PHI data, and it's really very straightforward, right? You have to have a place, right, to physically store protected health information, right, that is physically separated from any customer data that you have that is non-PHI. It's a HIPAA rule, right, that you cannot commingle PHI with non-PHI when you are storing customer information, when you're kind of running customer analytics or doing any of the stuff, right, that marketing technology tools give you the ability to do. You have to have those data sets separated physically, right? And that's one of the things, right, that Adobe's experience platform with the HIPAA readiness aspect to it brings to the table, right, is that we physically separate PHI from non-PHI, but then treat it as a singular data set when performing customer analytics, right, and generating insights into how, what is the appropriate journey or the appropriate experience to give to the customer in order to meet their expectations. We treat that clinical data, or PHI, and behavioral data, or non-PHI, as though it is kind of a universal data set, even though they are physically separated. And to my knowledge, Justin, we're the only ones that are doing that, right? Yeah. And so then the answer to another question from the audience is, how can we best provide a personalized healthcare experience while remaining HIPAA compliant, right? So it's like, how do you achieve that personalization that your customers are looking for while protecting PHI? And it goes very much back to what I was just talking about, is making sure that you're storing that PHI in a separate physical location that meets all of the requirements, regarding security and privacy, according to HIPAA law, but then you are using that data in a way that your customers have consented to, right? Mm-hmm. This is where we kind of bring in, and Justin, you mentioned this earlier, that if you are transparent, right, about what data you're collecting and how you want to use that data and what the value of that data usage will be to the customers, consumers are more than willing to not only provide it, but give you the consent to use it, right? So the key to kind of providing that personalized experience is, one, having the technology in place so that you're collecting and storing the data in a HIPAA compliant way. But then it's also managing customer identities, managing consent, and then being very transparent about how you're going to use that information, so that your customers are willing to let you use it. And then, if you've got a system in place like, Adobe's platform that enables you to perform holistic analytics on your customers utilizing both PHI and non-PHI, right? That's how you get that view into your customer's journey and kind of what their preferences are and where it is, what content is going to be relevant to them or resonate with them, so that you can craft this personalization dynamically in real time and do it right in a HIPAA compliant way.
For sure. And I think the other piece that we're hitting on too there, Tom, is that as long as folks have the comfort that, what you're going to do with my information, but even a step further, the ability for them to say, hey, you were leveraging my information for some time, but I'm not really comfortable anymore. So can you back me out of the automated marketing or whatever it might be? That is super important and relevant as well, too. And at the end of the day, to Tom's point, listen, we all have our own healthcare journey, right? We're all on different paths. But the one thing that we all want to do is we all want to do the things that we want to do. And we don't want a health problem to be limiting factor in us going for a run or taking our kids or our dog outside or doing anything, traveling, right? So within that realm, you have to remember that consumers, all of us are consumers, we all have that same mindset. So within that space, of course, we're going to share our personal health information if it curates a better experience or better products or better content for us that allows us to do the things we want to do with our loved ones. So I think that's an important mindset to have when you're thinking about, well, how should I approach this space? Maybe you're selling health and wellness products digitally and you're looking to try to find new categories to get into. Always remember that consumers are going to buy things that are going to help them live the lives that they want to live. So I think that's an important add-on as well.
Yeah, I love that, Justin. Thank you. We've got a couple other questions here that I think are interesting. Well, I'm going to follow up just on one, right, that just came in that says, how do you physically separate the PHI data and then treat PHI and non-PHI data as one data set? How you physically separate those things really comes down to tagging, right? So Adobe provides our customers with kind of a taxonomy architecture, right, where you have the ability to tag something as either being PHI or non-PHI, and you can actually break it up into other tagging methodologies, right, that make sense to you and your particular customers. But the bottom line is, if something is tagged as PHI by you, right, it goes one place. If it's tagged as non-PHI by you, it goes to a different place. Then when we perform analytics, what Adobe does, right, is with each piece of data, it has a unique kind of Adobe identifier as to kind of where it came from, and there's a lot that goes into the identifier. But it's based on those Adobe IDs then that we can kind of knit the data sets together to, utilize our AI, right, in order to make the assumption that this is the same person. Right. And that way you can connect PHI and non-PHI based on those identifiers while simultaneously keeping those two data sets physically separate. hopefully that answers the question. And then we also got another question, Justin, around user and the software both having to be HIPAA certified at the time and, that you're actually using it. I mean, again, right, software cannot be HIPAA certified, only the people can, right? But the bottom line answer to your question is yeah, right? If you're ingesting or doing anything with PHI, right, your platform needs to be HIPAA ready, and then the user of that PHI has to be HIPAA certified, right? Or else the entire kind of compliance of the system is going to fall down. Justin, do you see any other questions here that you want to answer?
There's a few. I don't know that I am the appropriate authoritative figure on some of them, but what I will say is there's some questions here on how much has changed regarding PIA, protected health or protected information, with the ability to have virtual physician appointments. That is obviously a super interesting space, and it kind of ties into what I was going to ask you, Tom. I was going to try to stump you with a question, and maybe this can kind of play into that question as well,
okay,
with like the virtual physical appointments. But I know we talked a little bit about AI, and I don't want to be that guy in a webinar that's going to talk about AI, so I'm not going to talk about AI. I am going to talk about AR, though, augmented reality, right? You have the Apple Vision Pro that's out now, and we see that everywhere. I mean, if you're on Instagram or TikTok, you see people walking down the street doing things, right? But I think it ties in nicely to the question that came in is, if you're leveraging telehealth or you're operating within not a doctor's office or a physical location, or you're wearing an Apple Vision Pro and maybe you're a doctor and you're trying to diagnose things, how does that world, or how can that world be protected, I guess, but also how do you sort of see that evolving as we move down the path of having the physical and digital world blend together in a way that, I mean, we've never seen it before, but I think I'd be curious to hear your perspective on that.
Well, and I think, Justin, that kind of blending of physical and digital, right, we're already seeing, right, with virtual care and telehealth. And as AR technology or VR technology continues to move more into the mainstream, we can only assume, right, that it's going to begin to impact healthcare, right? We said we weren't going to talk about AI, right? But AI is also already playing a huge role in kind of healthcare diagnostics, right? And it's only going to continue to play a bigger role because AI can kind of parse through data and make recommendations, a heck of a lot faster than any human being can, right? And that's going to just continue to play a bigger and bigger role. And I mean, we're already seeing the use of augmented reality or virtual reality in kind of medical education, right? So instead of actually having to work on a real cadaver, right, you can do it virtually. We're seeing it in physical therapy through kind of the gamification of physical therapy. It's like, can you bend your arm 90% further than you could the day before, right, as a result of, post-surgery, and being able to do all of that kind of in a virtual reality environment. I mean, yeah, absolutely. We're going to see more and more and more of that as that technology becomes mainstream. And I think it goes back to just in the very premise right around that we've been making this whole time, is that healthcare consumers are consumers. And they are bringing their experiential expectations from other industries into healthcare. And it is going to be paramount for healthcare providers and insurance companies and pharma and devices to keep their finger on the pulse, right, of what it is that's driving consumer sentiment and driving consumer behavior, and then make sure that they are adopting those same technologies. Because if they don't, they will be left behind by kind of technology first disruptors that aren't burdened with remembering the way things used to be, right? And I mean, and this, and maybe we can wrap up with this. It goes to an important question: is how do you see the convergence of retail and healthcare, right? And it's not only retail and healthcare; it's healthcare and high tech. It's healthcare and just about every other industry that healthcare consumers interact with, right? Because that's where we're building our expectations. That's where we're building, I expect an experience to be a certain way and to utilize certain data and to utilize certain channels and technologies. And if yours doesn't, I'm going to go elsewhere, right? It's the very thing we were talking about, moving away from kind of your primary care physician to, a CVS clinic. And you have companies like Amazon and Apple and Google's parent company, Alphabet. Those companies are actually investing more in healthcare and healthcare technology than any other subsegment in any industry, right? So right there, you've got like tech giants that have decided they want a piece of what is the single biggest percentage of consumer spending, which is healthcare. And if they can deliver that experience better, faster, and provide the things, Justin, that we were talking about, access, information, convenience, and utilize the technologies and the channels that consumers expect, they're going to, consumers are going to move in that direction. And companies like Amazon and Apple and Google see that, and they want to be a part of it.
For sure. Yeah, I mean, great points, Tom. And I think, it just drives home that there's nothing more important in life than the health and wellness of ourselves and the people we care about, right? So love the points. I know we're getting close on time here. There was a question around where someone can learn more about the HIPAA solution from Adobe in the documentation. We actually have a slide for that. So we'll talk, if you're looking to kind of get a demo of some of the things we talked about, you can reach out to myself at Proficient, obviously at Tom and Adobe as well too, but we can book a demo with you and kind of show you through this solution and how it could be applied within your business. This is kind of our little selfish commercial, if you will, on the solution that's out there. And then finally, we'll give a couple more minutes in case there's any other questions. But Tom, I'm not sure if you want to talk about this or we can collaborate just about Adobe Summit. I know that this is Adobe's flagship event that's coming up here in March. Both myself and Tom will be there in person, but Tom, I'll pass you the mic to talk a little bit about Summit and where folks might be able to learn a little bit more about this if they happen to be attending.
Yeah, like Justin said, right, Summit is the digital experience kind of flagship show that's taking place in Las Vegas at the end of March. We have, right, a kind of recommended agenda, right, that if you reach out, via this webinar, right, we've got an incredibly robust collection of either healthcare specific or healthcare relevant sessions, right, that will keep you very busy and very informed, during the 3 days of Summit. And we can make that kind of recommended agenda of these are the sessions that we think would be best for healthcare, for healthcare customers. We can put that in your hands. But this event is perfect, right, for those in healthcare and life sciences that simply want to learn what is the technology that's available, kind of what is the art of the possible, and it gives you the opportunity to network with a bunch of other healthcare and life sciences companies that are tackling the same issues that you are, because the healthcare industry as a whole, like we said at the very beginning, is kind of behind other industries. And the opportunity for you to kind of leverage the best practices of partners like Proficient and the tool sets of Adobe, where we've done this in retail and travel and financial services, to get you kind of into the game quickly and start to realize the value of, doing things in this particular way, utilizing this technology. is I think, invaluable, right? So, reach out to your Adobe sales rep. If you don't have one, reach out to Adobe in general and we'll get you one. And we can answer all of these questions and set up a great agenda for you to make the most of your summit experience.
Awesome. Yeah. Thank you, Tom. And I think it's a great point too, talking about healthcare being intrinsically maybe slightly behind. The great news, though, is that a lot of the things that we've talked about here today, they are happening, but you still have a window of opportunity to take advantage of providing the best possible solutions, digital experience solutions for your customers through some of the things that we talked about here today. So regardless of if you're at Summit or not, we have a really good solution here that can help. And I think we all appreciate you spending an hour with us or so here today, or if you're watching the webinar back, we appreciate you tuning in as well too. So Tom, I will pass it to you for the final word here of our webinar.
Awesome. Thank you, Justin. I so appreciate your perspective, your experience, and the questions that you answered. I mean, I hope our audience did as well. I very much appreciate you joining me today to kind of talk through the importance of HIPAA and the fact that we have a commerce-specific solution now. And if you're interested in that solution, Proficient is a great place to go in order to execute that. But with that, I mean, I think we can wrap. Jared, if there's anything, as producer, you kind of want to bring us home. Otherwise, thank you, everybody, for your time and attention today. And thank you for all of the great commentary that we're seeing in the audience chat. Everybody have a tremendous rest of your day.